There is a sleep disorder affecting more than half of all people over 60. It happens every single night. It deprives the brain of oxygen dozens, sometimes hundreds of times per hour. It silently damages the same brain regions responsible for memory, reasoning, and long-term cognitive health. And the vast majority of people who have it have absolutely no idea. It is called sleep apnea. And the research connecting it to dementia and Alzheimer's disease is some of the most alarming and most actionable science in cognitive health today. My name is Dr. Elena, and every week I bring you practical, science-based information on cognitive health and memory for people over 60. Subscribe if you haven't already, because what I'm about to share may be one of the most important things you hear this year. Most people know sleep apnea as the condition that makes people snore. And yes, snoring is one of its signs. But sleep apnea is far more than a nighttime nuisance. It is a medical condition in which the airway repeatedly collapses during sleep, causing the person to stop breathing, sometimes for 10 seconds, sometimes for a minute or more, before the brain triggers a micro-awakening to restore breathing. This cycle can repeat 30, 50, or even 100 times per hour, all night long, without the person ever fully waking up or having any memory of it in the morning. The consequence is that the brain never reaches the deep, restorative sleep phases it depends on. And as we discussed in a previous video, deep sleep is when the brain consolidates memories, clears toxic proteins associated with Alzheimer's disease, and performs the essential maintenance that keeps cognitive function intact. Every night of untreated sleep apnea is a night the brain's cleaning system fails to run. But the damage goes beyond disrupted sleep. Every time breathing stops, blood oxygen levels drop. The brain, which is extraordinarily sensitive to oxygen deprivation, responds to each drop with a micro-stress response. Over months and years, these thousands of nightly oxygen drops accumulate into measurable structural damage to brain tissue. Studies using brain imaging have found that people with untreated sleep apnea show accelerated thinning of the cerebral cortex, the outer layer of the brain responsible for memory and higher cognitive function, and reduced volume in the hippocampus, the brain's primary memory center. A major study published in the journal Nature Communications found that people with sleep apnea had significantly higher levels of amyloid beta, the protein that forms the plaques characteristic of Alzheimer's disease, in their brains compared to people without the condition. The researchers concluded that sleep apnea is not just a risk factor for cognitive decline. It may be an active driver of the Alzheimer's disease process itself. Now, here is what makes this particularly important for people over 60. Sleep apnea becomes dramatically more common with age. Hormonal changes, shifts in body weight, and loss of muscle tone in the throat and airway all make the airway more prone to collapse during sleep. And the cognitive consequences compound over time. Someone who has had untreated sleep apnea for 10 or 20 years has experienced thousands of nights of oxygen deprivation and toxic protein accumulation. The damage is not hypothetical. It is measurable, documented, and progressive. So how do you know if you might have it? Here are the most common signs. The first is loud, persistent snoring, particularly snoring that includes pauses, gasps, or choking sounds, which are the sounds of the airway collapsing and reopening. The second is waking up feeling completely unrefreshed, even after a full night in bed. The third is excessive daytime sleepiness, the kind where you fall asleep unintentionally, sitting in a chair, watching television, or as a passenger in a car. The fourth is waking up with headaches, particularly at the back of the head, caused by low overnight oxygen levels. And the fifth, the one that most people never connect to sleep, is increasing memory lapses, difficulty concentrating, and a persistent sense of mental fog, especially in the morning hours. It is also important to know that sleep apnea does not always present with loud snoring. A significant number of people, particularly women and older adults, have what is called silent sleep apnea, where breathing stops repeatedly but without dramatic snoring. These cases are frequently missed precisely because the most recognizable symptom is absent. If you are a woman over 60 who experiences unexplained mental fog, morning headaches, and daytime fatigue, but do not snore loudly, sleep apnea may still be worth investigating. The most important message I want you to take from this video is this: sleep apnea is treatable. It is not something you simply live with and accept. And treating it effectively produces real, measurable improvements in memory, cognitive function, mood, and cardiovascular health, often within weeks of beginning treatment. The primary treatment is a device called a CPAP, continuous positive airway pressure, which delivers a gentle, continuous stream of air through a mask worn during sleep, keeping the airway open throughout the night. Studies have found that consistent CPAP use reduces amyloid accumulation in the brain, improves scores on memory tests, and significantly lowers the risk of dementia in people who previously had untreated sleep apnea. The improvement is not subtle. Researchers have described the cognitive recovery in treated patients as among the most dramatic, reversible changes in brain health available to older adults today. For people who cannot tolerate the CPAP mask, and many people find it uncomfortable at first, there are alternative devices that fit inside the mouth and reposition the jaw to keep the airway open. There are positional therapies for people whose apnea occurs mainly when sleeping on their back. And in some specific cases, surgical options exist. A sleep specialist can evaluate which approach is most appropriate for each individual situation. The path to diagnosis is more straightforward than most people realize. A sleep study, which can now often be done entirely at home with a small monitoring device your doctor provides, records your breathing patterns, blood oxygen levels, and sleep stages overnight, and produces a clear, clinically valid diagnosis. You do not need to spend a night in a hospital. You sleep in your own bed. If you recognize yourself in any of the signs I described today, please bring this up at your next medical appointment. Do not wait. Every night of untreated sleep apnea is a night the brain does not fully recover, and those nights add up. Let me bring it all together. Sleep apnea affects more than half of all people over 60. It causes repeated overnight oxygen deprivation that damages the hippocampus, accelerates the thinning of the cerebral cortex, and directly drives the accumulation of the amyloid proteins associated with Alzheimer's disease. The signs to watch for are loud snoring with pauses or gasps, waking completely unrefreshed, excessive daytime sleepiness, morning headaches, and increasing mental fog. It is frequently undiagnosed, especially in women and older adults who do not snore loudly, and it is fully treatable with interventions that have documented and significant cognitive benefits. If this video made you think of someone you know, a partner whose snoring concerns you, a parent who always seems exhausted, a friend who keeps mentioning memory problems, please share it with them. This information could genuinely change the course of someone's cognitive health. Subscribe to the channel for a new video every week on memory and brain health after 60. And leave me a comment. Did any of these signs feel familiar to you? Or do you know someone who might be affected? I read every single comment. See you in the next video.